So this is about the establishment of the One Belt One Road International Medical Education Alliance in if you can proceed quickly. So this was in Shenyang last year.
One road और CPAC खित्ते के लिए गेम चेंजर। वक्त के साथ साथ इस तारीखी मंसूबे के सम्राट भी नजर आने लगे हैं। सिर्फ के शोबे में भी इनकलाब बर्पा होने को है। चीन के सूबे लियांग में बेल्ट एंड रोड इंटरनेशनल मेडिकल एजुकेशन अलायंस का क़याम अमल में आया, जिसके तहत होने वाली पहली कॉन्फ्रेंस कामयाबी से इख्तिताम को पहुंची। कॉन्फ्रेंस के दौरान इस अलायंस से मुताल्लिक़ डॉक्यूमेंट्रीज भी दिखाई गई।
So these are the different and what are the challenges we are facing these days for the tropical medical this area. The neglected tropical diseases, which is the dengue and the dengue hemorrhagic fever, and deaths per year, 3,000 to 4,200 deaths are caused, and rabies caused 26,000 deaths in all over the world. In Pakistan, these are the main causes of deaths for the tropical diseases which are being ignored. The dengue had an outbreak in Pakistan in 2011. And also we had a recent outbreak in 2019, 2 months ago. So these are the different the tropical diseases. I will not discuss in detail because of the time limit. So in 2011, we had this dengue outbreak in Pakistan. And here you can see a paper published, and this is the data about the number of deaths caused by the dengue and the number of incidents of dengue fever and dengue hemorrhagic fever. So there was a team from Sri Lanka and Thailand, and they came to Pakistan and they collaborated to fight against the dengue and dengue hemorrhagic fever. These are the different guidelines in Pakistan language Urdu to fight, to give the awareness to the common people. And what are the challenges? These are the new challenges with the new infectious diseases. The Zika virus, Ebola virus, they are a challenge in this area. What are the recommendations? So we need a multidisciplinary link where the universities, training centers, research and development, hospitals, and IT and the big data and pharmaceutical institutions, they can join hands. As Professor Shahbaz told before, that we are at the verge of, we need to alarm and we need to wake up. So my recommendation is we need to establish a multidisciplinary link, because one department cannot cope with these kind of eruptions, with these kind of outbreaks. So we can have international cooperation and communication for the disease control, doctor and medical staff exchange programs and data sharing, advanced skill training programs, the accommodation and inclusion of already established hospitals in One Belt One Road, medical technology cooperation, advanced remote training, and the telemedicine. Telemedicine can play an important role for the treatment of the patients in the remote areas. And the regional cooperation, and we also need the frequent online meetings. I see that the website of Belt and Road Tropical Medical Education Alliance has been developed, but for next 1 year, I think there will be less communication. We need to have a frequent communications between different institutions around the globe.
Patients don't need to travel for hours, wait for hours, find out
we can also get the use of 5G technology, which will be available
at home or at a local care service with an assistant by using digital solutions such as the digital stethoscope, devices measuring electrocardiograms, pulse, blood pressure, and all the vital signs, including blood markers as well.
So this is the new technology. We can take advantages of the 5G, 4G, and the telemedicine can be practiced in the remote areas where the doctors cannot travel and in a short time. And this is also a new technology which I would like to share with you for the medical education. We can use the virtual reality and the augmented reality. If you can play the video. Yeah. So we can have this, the image of the lungs and the internal organs and vessels using the virtual reality, and it can help for the precise diagnosis. And this is the video for the medical education for the students. They can use this, the virtual reality, the Oculus, they can wear the Oculus, the Google glasses, and they can see and learn the anatomy of different organs in the body. So this is another suggestion, recommendation. We can use the artificial intelligence and the big data.
It learns the language, the jargon, and the mode of thought of that domain. Take the term cancer, for instance. There are many different types of cancer, and each type has different symptoms and treatment. However, those symptoms can also be associated with diseases other than cancer. Treatments can have side effects and affect people differently depending on many factors. Watson evaluates standard of care practices and thousands of pages of literature that capture the best science in the field. And from all of that, Watson identifies the therapies that offer the best choices for the doctor to consider in their treatment of.
So we can also get the help from the big data and the artificial intelligence for the medical education and the clinical treatment. And this is another recommendation that we can have, the medical tourism. Hainan is a beautiful, the province, and the Haikou and the Bo'o, they are very beautiful the places, and we can also develop this kind of the medical tourism. The patient from the other countries, they can come to China, and the Chinese teams of doctors can go to other countries, the remote areas for the medical treatment. Because China has a vast experience, and China is a big country, the health care providers are in a big number, and they have also the skills and also the equipment. So the Belt and Road Tropical Medical Alliance can take the step for this initiative. So we can also establish the Belt and Road Tropical Medical Alliance force. So this can be an alliance, and every university or the hospital can nominate their experts, and these experts can go to different countries. If there is an outbreak, for example, there is an outbreak of dengue in Pakistan, there is an Ebola outbreak, there was an Ebola outbreak in the Africa, some regions, and Zika virus. So these teams can either they can train the experts, or they can send their experts to these countries. And I would like to thank at the end to the Professor Yang Jun, the President of Hainan Medical University, Professor Huang Yanhua, and Professor Sun Xiaoning, and Miss Lily, Miss Wang Xiying, and of course my wife, Kainat, and all the Belt and Road Tropical Medical Alliance team to making this event a success. And I would like to say the Zhongpa Yoyi Mansui.